to you about a very powerful and natural antibiotic that we use in our clinic to treat drug-resistant infections, chronic fungal infections, as well as viral infections. This antibiotic is known as colloidal silver. You're probably aware that there's a growing problem of drug-resistant antibiotics. What this means is that simple infections that generally take a few days to treat now persist for weeks, months, and sometimes years, and progress into chronic infections as well as life-threatening complications in the human body. Now I'm going to talk to you about how we use colloidal silver in our clinic and also how colloidal silver works. But before then, I want to say a few things about colloidal silver. Colloidal silver simply refers to particles of silver suspended in water, and its strength is measured in parts of colloidal silver per million parts of water. Colloidal silver is completely different from other kinds of silver, like silver salts, which are not fit for human consumption. There are several scientific studies that prove the effectiveness of colloidal silver. Colloidal silver is powerful, destroys bacteria such as E. coli, Streptococcus Staphylococcus. It destroys viruses like adenovirus, herpes virus, papillomavirus. It's effective against fungus like candida. It destroys worms and parasites. If you check on the colloidal silver page of our MedB website, that's medb.es, you're going to find a list of over 20 studies that prove that colloidal silver is effective against viruses. And colloidal silver does all this without causing any side effects and is also non-toxic to the human body. There's a story circulating online about a man who took silver salts and his skin turned blue. It's important to realize that this man took silver salts and not colloidal silver. Colloidal silver has zero toxicity to the human body and also has no adverse effects. Now I'm going to talk about how colloidal silver works. Colloidal silver destroys microbes by destroying or disabling the metabolism and respiration of these microbes, and it does this by destroying the enzymes that control these processes. Other studies have also shown that colloidal silver can bind or attach itself to the DNA of viruses, and this way stops viruses from replicating and spreading around the body. Colloidal silver also attaches itself to the surface of microbes such as bacteria and virus and also stops them from entering cells. We have used colloidal silver for over 5 years to treat a range of infectious diseases such as respiratory infections like sinusitis, pharyngitis. We treat a host of gastrointestinal problems like gastritis, gastric ulcers, duodenal ulcers, colitis. We treat these with colloidal silver. We also treat pelvic infections like prostatitis, urinary tract infections, and we have been able to compare how effective colloidal silver is using our monitoring diagnostic technology, and we see that within sometimes days or weeks, colloidal silver destroys nearly all these microbes. I would recommend colloidal silver as a first-line